Imagine a world where constant knee pain is no longer a debilitating condition. A world where the quality of life is not compromised by the throbbing, aching discomfort of osteoarthritis, where the knee's cartilage is unscathed, and daily activities aren't marred by pain. Enter the realm of stem cell therapy, a regenerative solution for knee pain. With its scientific basis rooted in the body's own healing mechanisms, stem cell therapy offers a beacon of hope, transforming patient lives through its process, benefits, and outcomes. But the key to managing knee pain doesn't stop at stem cell therapy. It extends to physical therapy, with customized exercise programs tailored to strengthen supporting muscles and reduce strain on the knees. Weight management plays a crucial role too. Even slight excess weight can exacerbate knee pain, making effective weight management strategies an essential part of knee health. Low-impact exercises, when safely incorporated into daily routines, can improve knee function and reduce pain, while modifying daily activities using assistive devices and changing exercise habits can significantly reduce stress on the knees. Knee support devices, from braces to other assistive tools, can provide relief when chosen based on individual needs. Non-steroidal anti-inflammatory drugs and other medications offer another layer of support in managing knee pain, while corticosteroid injections, though effective, should be considered in light of their limitations and compared to the long-term benefits of stem cell therapy. In this world, knee pain is not a life sentence. It's a condition that can be managed, controlled, and even healed. The key lies in a comprehensive approach to knee health, where every aspect works synergistically to improve quality of life. This is the world we strive to create.